If you are diagnosed with a long-term condition, it's really a journey into a whole new country for you, a strange country. You're all of a sudden having to communicate with healthcare professionals who speak an entirely different language. And imagine that you are literally being sent away to a different country, how strange that would feel to you. Some of the barriers are time, and I think when you've got a very limited window, it's very tempting to become much more doctor-centred and take control of that consultation because you're having to time manage. In the long run, I don't think that saves you time, and so I think it is worthwhile trying to be as person-centred as you possibly can, listening and involving the patient as much as possible. It may be time-consuming to begin with, but over time I think is a winner. I think another key barrier that we have in supporting self-management is that on the whole we have very poor understanding and relationships with services in the community that help support people with self-management. And it may be that if I had a heart condition, it may be very useful to join a walking group, for instance. I would go and see my doctor, and my doctor might not know what is available for me in the community. And I think that's a big stumbling block. And I think if we can find ways of forming links between general practitioners and these services that are in the community, so that it works both ways, then I think that will be very, very useful to help support self-management.
My top tips for self-management are that we must remember that not everybody is able to read or write or necessarily easily speak or necessarily easily understand what it is we're offering, what our services do for them. So whatever we do, we need to remember that there's thousands and thousands of people out there who won't necessarily be able to read the letter, won't necessarily be able to read or respond to the leaflet, won't be able to pick up the phone or use the internet, or in fact join big self-management groups or self-help groups. What we need to do is understand the communication needs of the whole community and be truly inclusive in our communication.
The biggest one I would give is to stop labelling people and not calling them patients. They're people living with long-term conditions. Thinking of them as people, not thinking of them as a disease, not thinking of them as bits of a disease, but thinking of them as a whole person. Other tips are around thinking about your own experiences. How did you feel? Put yourself into the situation. How would you feel if that was you? How would the family member feel? And try and put it into that kind of perspective.